My course is the first course in the P1 year that actually deals with drugs and how drugs work. Pharmacology is the study of the mechanism of action of drugs, and my course is designed to introduce basic principles of how drugs work first, and then to introduce the various classes of drugs, most of which in my course act in the central nervous system. So it's basically a course to learn the names of and the uses of, the effects, the side effects, the mechanism of action of the drugs that are used in clinical practice, most of them acting in the brain. It builds heavily upon an understanding of basic biology, physiology, human physiology, especially central nervous system physiology. It builds on organic chemistry because part of the course is medicinal chemistry, which is the science of how organic molecules are made to have a particular activity. So these are the molecules that become the drugs that we use clinically. So it builds on biology, chemistry, especially organic chemistry, and physiology. Pretty much all of the other courses in the curriculum build upon it. First comes to mind the CDM modules. All of them make use of the understanding of pharmacology and how drugs work in order to understand how they'll be used clinically in patients. So that's the main area where they're going to be used. But all of the other courses in the curriculum that follow mine also build upon it. Biopharm, kinetics, all of the courses that basically build on an understanding of drugs and how they work. That's a good question. I think that if they didn't take my course, they would not be able to understand any of what follows. They wouldn't be prepared to move into the professional curriculum and understand how medications work. They wouldn't be able to interact with other healthcare providers and explain how drugs work. Pharmacists are the drug experts. They are expected to be the people who know all of this information. And so without this basic foundation about how drugs work, how they're built, what they look like, how they act on receptors, we wouldn't be able to provide the next step in your education, which is to use them clinically. Again, if one doesn't have an appreciation of how drugs work, their basic pharmacology and their medicinal chemistry, you won't be able to use them clinically. My course comes from extensive research. In order to understand how drugs work, there's been a lot of work done in the laboratory before they reach the market to understand their work at an organ system level, a whole animal level, at a molecular level. And so research has basically generated these drugs and makes them possible. But in the same way, research will go on after they're introduced on the market to understand better how they interact in a human system, how they produce their effects and their side effects in patients. So research is an essential part of generating them as well as the further study of them.